Welcome back. I'm Dr. Cheek and I'm a licensed clinical psychologist. And today we're going to talk a little bit about some of the less recognized signs of depression. So to begin with, let's focus on some of those more recognizable signs or common signs of depression, like increased sadness or irritability or increased mood swings or variability in your mood. Also, increased desire to isolate or not engage socially. There may be increased alcohol or substance use. There may be changes in your appetite or the way you eat. There may be changes in your sleep patterns. You may sleep too much or you may not get enough sleep. So these are the most common signs of depression. These are the most recognizable signs of depression. And now I want to spend some time to focus on some of those signs of depression that are not always recognizable. And that very first one is overworking, or what we sometimes like to call being a workaholic. And I want to start by saying this is not for the individual who enjoys their work, that gets some level of fulfillment out of the job they do, and they get enjoyment by doing the things that they do on a daily basis for work. This is more geared towards those individuals who may be working in a stressful work environment, who is in a career or in a job that's not fulfilling or not satisfying in any way, and all aspects of the job feel like a chore or something that's a hassle. So it feels like working feels like an added stressor. So these are for those individuals, and those individuals who tend to work in these stressful environments, in these unhealthy work environments, to exhaustion or to excess. And people tend to work to exhaustion or excess when they're dealing with depression because they may be wanting to, one, avoid the situation or the environment that's causing this increased level of sadness. They may be wanting to avoid the uncomfortable emotions or having to deal with the thoughts, so they are distracting themselves by doing work. So their mind isn't wandering on the thoughts that they're having about their experiences or what they're having to deal with or the emotions that they're feeling in the moment. So work becomes that distraction that they need in the moment. And also, work can be utilized as an excuse to not do something enjoyable or to be able to engage socially. And normally when we don't want to engage socially, or we don't want to do something that feels or used to feel enjoyable that may not feel enjoyable at this moment, is because we fear engaging in those activities and not having that same joyful or enjoyment or that same pleasurable feeling that we would get out of doing that previously to feeling depressed. And now that we're in this depressed mood, if I say I have to work, then I don't have to make time for an event or make time for this social engagement or this enjoyable activity that I feel like I won't get any enjoyment out of, even though it's something that I used to truly enjoy engaging in. And sometimes we may overlook overworking or working to exhaustion as a sign of depression because we justify it by telling ourselves that we're doing this type of work or we're doing this level of work to get ahead or to get more financial freedom or to gain more money. And in those instances, that could be a contributing factor, but at the same time, it probably more than likely, if you're overworking or working to exhaustion in an environment that is very unhealthy, chances are that may be a sign of depression, especially if you're avoiding some emotional experiences or some environmental factor that may be contributing to your depression. Now, the second less recognizable sign of depression is a desire to engage, but no true motivation or energy to do so. So this could be attributed to low dopamine, as many studies have shown that lower dopamine levels can contribute to depression. And dopamine, if you don't recall from a previous video, is that reward hormone. It's the pleasurable feeling you get when you complete a to-do list or when you do an activity or when you do something that you feel is rewarding and that you feel like you are achieving a goal with something you set out to do. And it's also that movement hormone. It's a hormone that's also associated with getting us motivated to move and do things. So when we have lower levels of dopamine in our bodies, we may not have that motivation or that drive to move because we don't have the hormone that's necessary to get that movement started, to allow us to initiate that movement. And although the desire to engage is there, the energy and the motivation is lacking. And we sometimes don't recognize this as a sign of depression because we do want to engage. And far too often we assume that when we are depressed, we don't want to be social, we don't want to engage. But sometimes we actually do want to engage, but we just lack the energy, and we don't recognize it as a sign of depression because we say things to ourselves like, you're just being lazy, or you're not trying to do what you need to do for today, or you're just not wanting to do the things that's on that to-do list. But in actuality, the depression and maybe possibly a lower dopamine level is contributing to that lack of motivation to tackle that to-do list, or to hang out with friends, or to get out and to be more social, or to take care of those chores that you've been avoiding for much of the week or the month. So that is sometimes a less recognizable sign of depression. Is I do want to engage with my friends. I do want to clean up or straighten up. I do want to take care of that load of laundry, but I just don't have the energy to move. I just don't have the motivation to get up and get started. Now, that last less recognizable sign of depression is feeling drained by every social interaction. And I want to take a moment to kind of distinguish feeling drained because of depression and feeling drained because you are maybe a natural introvert. And when you are introverted, you are sometimes drained by social interactions, but you're not drained by every social interaction. There are certain environments where you are energized by being around a certain group of people, where you're energized by being in that environment. Even as an introvert, it doesn't drain you or deplete you of your energy. So that's what it looks like when you're an introvert. There are certain environments that can be draining, and there are certain environments that can be refreshing and that can be restoring, even if you are an introvert. Now, what it looks like when you're feeling some level of depression is that every social interaction feels draining. And every social interaction feels draining because you feel like you have to pretend, or you have to put on a brave face or a happy face in those environments. So you're displaying emotions that don't feel genuine in those moments. So it feels draining because you are constantly trying to present in a way that does not feel genuine to what you're feeling inside in those moments. So those social interactions that feel draining, that can be a one-on-one in-person interaction, that can be a text exchange, that can be wanting to reach out on social media, or being able to be social in any way. All of those activities then feel like a nuisance, and then feels like something that is draining and depleting you of any energy reserve that you may have. And all of those activities sometimes feel like it requires more energy than it typically would when you're not feeling this level of depression. And we sometimes overlook this as a sign of depression because we tell ourselves that we're either introverted or we don't like people. And this is why interactions with people feel draining. And when we say that and don't really investigate like what's really at the core, or what's really at the root of that lack of energy or desire to engage with people, then we don't really give voice to that depression that we may be feeling. So these are the least recognizable signs of depression. And they can occur at any time, and they can co-occur with the common signs of depression as well. Now, there are some traditional treatments for depression. So there is the psychotherapy, so either behavior activation or CBT or meditation or being very mindful. There is acceptance and commitment therapy for depression. There are different treatment modalities in psychotherapy for depression, and there's also medications. The frontline medication for depression typically is an SSRI. And there are other medications that can be prescribed as well. I advise you to speak with your medical professionals, whether it's a primary care physician or a psychiatrist, about medications that may be helpful for depression. Now, there are times where the depression that we're feeling does not subside or does not lessen with the traditional forms of treatment. And this is what we consider treatment-resistant depression. Now, there are some interventions for treatment-resistant depression as well. Those common or most used interventions at this time for treatment-resistant depression is ketamine, is vagus nerve stimulation, or it is RTMS, or repetitive transcranial magnetic stimulation, or it's also ECT, or electroconvulsive therapy. These are those treatments that they use for treatment-resistant depression. So you may have heard of those as well. So what I hope you learn from today is this. There are some less common signs of depression, and they're typically that desire to overwork, or that desire to engage but no energy, or feeling completely drained by most social interaction. Those are some less recognizable signs of depression, but also can let you know you are feeling some level of depression, and be willing to examine that in yourself and check in with yourself to see if depression is what's driving those behaviors. And I want you to also know that there are treatments for depression, even when you have those less recognizable signs of depression. So be willing to reach out for assistance when those things occur. So, as always, I want you to take time to jot down any thoughts, questions, or comments you have below. I hope you've learned something from today's video. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.